good?
Mm-hmm.
All right, so today I have James Wilson. So for the medication administration, I would I'll go to the med dispense. Just in okay. So I would wash my hands real quick.
Wow, the sun is really annoying.
Now it's sign on. This one. All right. Okay. And then I would find James Wilson on the med dispense. Oh, there we go. And then making sure it's right patient, James Wilson. James, and he has an allergy to NSAIDs, so make sure of that. So now for this, I'm going to do my 6 patients, right? So right patient, right medication, right dosage, right time, right route, and right documentation. So let's see here. So we're doing the 8 o'clock medications. So we're doing the hydrochlorothiazide of 50 milligrams by mouth, and also the atorvastatin, which is 10 milligrams. And we also have both the insulins and a sliding scale and a flu shot to deal with. So let's see. Let's do the Yep, I checked the allergies. Enter. And then the vastatin. Yep. And then let's see, we got regular insulin. Yep. NPH. Yes. Need 16 units of that. And then 1 influenza shot. Alright, that's all we need. So let's open the drawer. So this is the hydrochlorothiazide. There we go. Hydrochlorothiazide. It's 50 milligrams, and its expiration date is 10/10/25. Okay. Just put that there. Close that. Next is the atorvastatin. There it is. All right. Checking that it is atorvastatin, and that is 10 milligrams, and its expiration date is 10/10/25 again. All right. The next one. Let's see. We are getting regular insulin, which is 100 units per ml. Expiration date. There we go. Expiration date 1/20. Okay. That up. Next one, we're getting the NPH insulin. Right here, I believe. Oh, I hope that they didn't cover it up with this orange. Oh, there we go. Expiration date 1/20. I can't find the concentration. I think it might be covered under. Oh, there we go. You can kind of see it. It's 100 units per ml, I believe. And then finally, the influenza vaccine. Whew. Oh, that was scary. Right, so here it is, the flu vaccine, 0.5 ml per dose, expiration date 10/10/25. Alrighty. done, and now I'm logging off. Okay. Now I'm just gonna go grab my shots and my needles and prepare everything over here. Alright, so let's see here. This is my IM. Here's my insulin. Alright. My gauze. Alright, alcohol pads. I'll leave this open for everyone else. One, two, three, four, five. Just an extra one. Grab a Band-Aid. Okay, so from a report, I have checked his blood sugar and it was 169, sorry about that. So for his sliding scale, that means 2 units of the regular insulin, so that's 8 units total of regular and 16 of NPH. Alrighty, so for that, I'm going to draw up, actually, gonna roll my insulin. Make sure it's nice and ready. Okay. Can you check that this is 16 units that I'm putting in of air?
Yes. Okay, turn it a little bit so we can see the number. There we go. Okay.
All right. So, first, so that's 16 units of air. But first, I need to sterilize MPH and the regular insulin. I almost got ahead of myself. Oof. Alrighty. So I clean the tops off. Leave that there. So I'm gonna inject the NPH first with air. Alright. And then for the regular, so we got 2 plus 6, so that's gonna be 8. Can you check that that is 8 units?
Mm-hmm.
Alright, thank you. Alright. And then for this one, I'm going to overdraw so that I can get this bubble out the top. And there's a bubble on the bottom too. So that's 8 units of regular insulin
Mm-hmm.
without bending the needle. Bless up. All right. So from the MPH, again, 16 units for a total, let's see, oh God, mental math. Plus 2. Okay. 8 plus 2, that's 10. And then 10 plus 14, so 24 is going to be my total number. Slowly drop. Alright. And can you check that this is 24 units?
Perfect.
Thank you. Alright. So there's a problem, Ashley. There's no label things, like those little tiny label ones. So, we can't technically label them correctly. We looked over, I think they might be over there, I don't know. But for this one, if we had the little labels, put it right here so we wouldn't block any of the numbers. We'd put insulin, 24 units, date, which is 2/18, 2020, and the time is 8:14, and then their initials. But we can't do that. All right, now I'm going to draw up, put that over there. I'm going to draw up the flu zone, or the influenza vaccine. Oof. Alrighty. So again, now preparing this too. The flu zone. Doo-doo-doo-doo. Keep this sterile. Alrighty. That all over there. Okay. Alright, so for the flu zone, we need 5 milliliters. I mean, 0.5 milliliters, sorry about that. 5 milliliters would be crazy. Put that right here. I sterilize that. And checked there. Oh lordy. Alrighty. So I'm gonna overdraw for this one too, because we got some big bubbles. Alright. And then I'm just gonna whack it to get the rest of the bubbles out. That's a very technical term, whack. Here we go. Got that little guy out. Oh, tiny one. Alrighty. Oop. There we go. Bubbles on top. Can't have bubbles on top. Let's see. Okay. Ooh. Got some spillage. Bring that over here. Alright, can you check that this is 5 milliliters?
Mm-hmm.
Alrighty. So, I would cap this. So again, Ashley, we don't have the little label things, so I would label it the floxazone 0.5 milliliters, and then date, which is 2/18/20. Time is now 8:18, and their initials, so it would be JW on both of them for James Wilson. So I have everything. Now I'll redo my check again, my safety check. So hydrochlorothiazide, 50 milligrams by mouth, yes. And then the avoralstatin, 10 milligrams, expiration date. And then if these had labels, insulin, we have 24 units, 16 of NPH, and the 8 from the sliding scale, and from this. And then we have our flu zone, 0.5 milliliters. And then I'm just gonna grab these cups. I know they're used for measuring PO medicine, like liquid medicine, but I'm just gonna use this as containers for my tablets because there's no paper ones over here. I'm going to take these with me. They're there. I'm gonna take the Band-Aid also with me. So that was my second safety check. I'm gonna use this as a tray. Oh, actually there is a tray. Ooh. Maybe I should have used this when I got up there. Sick. They have trays though. Ooh. Actually, I'm gonna grab an extra Band-Aid just in case. Alrighty. So we're gonna head over here, grab 2 sets of gloves. I'm just gonna put in. Is it okay to put it in my pocket?
No idea.
Probably not. I can't ask my assistant.
Well, they would probably be in the hospital room.
Yeah.
When you.
That's true. So I'm going to the patient's room. Alright. Knock, knock, knock. Ooh. How's it going, sir? My name is Evan, and I'm going to be your nurse today. I am here just to administer some medication that the doctor has ordered for you. It's just mainly mostly regular stuff plus a flu shot. Alrighty. So, hand wiping. You might want to come on this side. Provide him privacy. Okay. Alright, sir. Can I get your name and date of birth? Probably have name and date of birth, James Wilson, 2/12/1952, and he'd probably have an allergy band that says for NSAIDs. All right. And so let's see. By reading his report, I would know that he was probably taking he's taking a statin and a hydrochlorothiazide. I know through, let's see. That the hydrochlorothiazide is for his hypertension, so blood pressure. So I'd have to take his blood pressure, which has already been taken by the report. And his blood pressure is 148/88, and his pulse was 86, respiration 16, and pulse ox was 96%. So he just has a very high blood pressure. Alrighty, sir. Okay. So now I would do my third and final safety check. So I would check for the avoralstatin. Ooh, I'm gonna go grab a trash can real quick, just so I can throw these pills away. Yep. So third safety check. Avoralstatin, 10 milligrams, expiration date. Yep. is hydrochlorothiazide, 50 milligrams by mouth. Yep. 24 units of insulin. Yes, yes. And then the 0.5 ml of 0.5 ml of the fluzoxime. Ooh. I'll be right back, sir. I have to go grab some pads. I'm gonna take this with me just in case. I forgot alcohol pads. Don't forget your pads. Take this with me. Sorry about that, sir. Had a little, little brain. No, that'd be. Had a little memory issue technically. Sorry about that. Okay, so this is your hydrochlorothiazide. It is used for your hypertension. So it's just gonna bring that down because as I did before, we saw your blood pressure is kind of high. So you just want to bring that down a little bit, just so you can get out of here early. Because I know you've been here a while, so you just want to kind of head out of here. Ooh, this guy is stuck in there. Ooh. Now dispose of this, and then I'm gonna pretend this is a water cup as well. So can I have you take this by mouth, sir? And he takes it, drains the water, and then do I just dispose of this in the trash, right? Is that okay?
I don't remember her saying anything about it, but
Okay, I'll just keep this in here just in case.
yeah, that was my question. That's what we do with them.
So he would have taken it by mouth orally, and then this is your avorvastatin. This is so this is this is something to reduce your risk of of stroke or heart attack, because we don't want that. We want you nice and healthy up here. Alrighty. So that in there. This is water now. So I give it to him. He takes it down the hatch. There we go. And then so there's there. Alright, sir. Now we're gonna have to do some. Now we're gonna have to give you some shots. I'm gonna give you a subcutaneous shot of insulin in your left lower abdomen right here, and I'm gonna have to give you an flu shot in your arm. So one's just gonna be in your tummy down here, and one's just gonna be up in. I'm gonna go for left side too of your deltoid, or just your upper arm. All right, so I wonder if we could get a blanket, because we need to expose him, and it kind of exposes, because he's got genitalia. Well, we need like something to cover him up.
I would just verbalize that you'll do that.
Okay, so
You'd provide privacy.
yeah, so I provide privacy. I would try to find something to cover up his genitalia. Ooh, sorry, sir. Got caught on your thumb. Gotta move this up for you. Alright, so where I'm gonna go to the umbilicus is right here, so 2 inches down from there, and I'll probably go in this area right here. And then while exposing him, I would provide privacy to his genitalia area. Alright, cover you up. So for this, for the subcutaneous shot, so this, sir, is just gonna be your insulin. You do have diabetes. You do have type 2 diabetes, so we're just making sure that you're nice and regular today, because we're gonna get some breakfast after this. So what'd you order for breakfast, sir? Ooh, pancakes and some steak in it. It's just pancakes, eggs, and hash browns. Hefty breakfast, sir. That's nice. Wouldn't mind some pancakes myself. Oh lordy. There we go. I don't like these gloves sometimes. They They feel very flimsy, so I feel like I might rip them if I try too hard. Oof. There we go. There we go. Alrighty, so I'm gonna put some. I'm gonna swipe your skin, that area down there by your stomach where I was poking at. I'm gonna swipe it with some alcohol, so it's gonna be cold a little bit. Sorry about that. Just a little circle. There we go. Throw that away. And we're just gonna let that dry for a second. Alrighty. Hasn't dried yet. Just gotta wait a little bit longer. So, are you ready to go home, sir? Hmm? Do you have any what are you gonna do when you get home? Just lay around for a bit, watch some TV, or are you gonna go on a walk or something like that? Okay, that's good. Alrighty, so we're ready to go in. Okay, so he is quite skinny for his size, so I would say we're going in at a 45-degree angle, bevel up. We're gonna pinch, poke, stabilize. We would inject, and then stabilize again, and then retract it out, putting that down, and then throw this away right away. Do not recap. And then put pressure on it, just in case he does not have anything, any blood thinners, so he's not a big bleeder, so that's good. All right, then I would take this off, throw this away. And then for his new site, I would get new gloves and hand sanitizer. All right, sir, so I hope that wasn't too bad. Now we got our final shot, which is your flu shot. It's just gonna be in your upper arm area. We're just gonna keep on going left side, left side. It's kind of like that movie, what is it? That football movie. It was always a left side, strong side, right? So we're doing your strong side. I hope you aren't left-handed though. Your arm's gonna feel a little bit sore today, and your insulin shot might feel a little stingy as well. So if so, that is a common thing to happen. So for his flu shot, we would reach it up here. We'd find the acromion process, just right about here, and I'll go 3 fingers. So I'd say it's right there. 3 fingers down from there. Right there is that injection site. So again, grab his alcohol pad, and then, ooh, come on, baby. Come on. There we go. Start in the center and make little circles out. Alrighty. Then we just wait for it to dry. And then for this shot, we do not have to do Z-Track or aspirate for this one. And I am using a subcutaneous needle because he's very skinny, so it'd be easier. And if I use the longer, bigger IM ones, I feel like I might stab into like a bone area or something like that. All right, so it has dried. Take this off. Ooh, almost lost the needle there. Pinch, and then straight in, inject, stabilize, and then pull out. Alrighty, and then lay that down, pressure on there. And then I would recap this on the table, throw it away. And then I would then give him a Band-Aid because this one is a bleeder. All right, sir, can you hold pressure on that? he would hold pressure on there as I prepare it, and then ooh, this is so hard. Okay, there we go. Dang. It's hard. It's so like that stuff is so slick on these gloves. God no. Alright, and then I would what the okay. Now I throw that away and put a band-aid on him. There you go, sir. Alrighty. And then I would take my tray out. Alright, sir, if you need me, your call light will be here. I will check on you in the next 30 to 45 minutes just to see how your glucose levels are, okay? Alright, sir, you have a good day, and I hope you have a great breakfast, alright? Oh, I almost forgot. If you need to know anything about the flu shot that you're given, here is some information about it. It has why you get vaccinated, why the influenza shot, and all this other great stuff. So I will leave this here for you. Ooh, almost slipped my mind. There you go. All right, you have a good day, sir. And after that, I would do his documentation. So for his hydrochlorothiazide, it's just for both of his PO ones, it's date, time, and my initials. So the date, come on, lead, 2/18/20. Time is 8:35. And he had, and my initials, EF. That was satin, same thing, 2/18/20, 835, EF. Insulin, 2/18/2020, 835 still. And then this was in left lower abdomen, EF. I'll just repeat it for the. Do I have to repeat it for all the insulins, or should I just do it I'll probably just do it for all. 2/18/2020, 835, left lower abdomen, EF, and then 8/18/2020, 835, left lower abdomen, EF, and then same as the insulin, but change my my route. Location, sorry about that. Left deltoid, EF. And then initial down here, EF. And then Fenske. All right, and that'd be it for it. So my S-bar. So the situation is James Wilson, date of birth is 5/12/1952. He was admitted 2 days ago with COPD exacerbation. He has a history of hypertension, hypercholesteremia, and diabetes. So when we got in, his blood pressure was 148/88, pulse was 86, respiration 16, and pulse oximetry of 96% on room air. All right. and his blood sugar was 169. So when we got in there, I gave him his regular scheduled 8 a.m. drugs along with a sliding scale of 2 units, and I also administered his flu vaccine, which was ordered by the doctor. And my recommendation would be to come in 30 to 45 minutes to check on his blood sugar levels to see if they need to be adjusted at all. That's it.
You want me to stop it?
Yes.
Oh, actually, let me look, just get a picture of this thing.